Despite being saddled with massive inherited debt, the government will continue to roll out initiatives to help the people, especially those in the low-income group or the B40. This was the assurance given by Prime Minister Tun Dr. Mahathir Mohamad, who launched the National B40 Protection Scheme known as My Salam today. According to the Premier, the My Salam B40 National Protection Scheme will provide insurance and takaful benefits protection free of charge for the B40 group who receive the People's Living Aid, BSHR. The scheme will affect some 3.69 million Malaysians between the ages of 18 and 55 under the group, helping them deal with financial difficulties arising from admission to government hospitals or when struck with one of the 36 critical illnesses. Tun Dr. Mahathir added, the My Salam scheme is a significant move towards formulating a financial development policy that is more inclusive in Malaysia.
Pada tahun 2017, kadar penembusan insurans dan takaful dalam kalangan B40 yang bekerja adalah masih rendah pada kadar 30.3% berbanding dengan kadar 50.4% bagi kesemua rakyat bekerja. Kita berharap My Salam dapat meningkatkan penembusan insurans dan takaful untuk golongan B40 kerana ini amat bermakna dan penting dalam usaha kita meningkat taraf dan kualiti kehidupan kumpulan ini.
Tun Dr. Mahathir also announced My Salam Seed Fund of 2 billion ringgit provided by Great Eastern Insurance and Takaful. Those under the scheme are entitled to free health coverage involving the 36 critical illnesses such as cancer, heart attack and Alzheimer. The recipient of the My Salam scheme will also be entitled to a one-off payment of 8,000 ringgit if identified with one of the critical illnesses. A daily payment of 50 ringgit will also be given to the recipient who undergoes treatment at a government hospital for a maximum of 14 days a year. Coverage under the scheme commences January 1st next year, and the scheme's registration and takaful claims can be made from March 1st. Meanwhile, in order to prevent the high rate of non-communicable diseases, NCD, among the B40 household income group, the Health Ministry will also be introducing a new scheme known as Kim Peduli Kesihatan or PERKA, which will be announced on January 28th. The PERKA scheme, which is a pioneer project worth 100 million ringgit allocation, will focus on early detection of NCDs and will also be made available to BSHR recipients aged 50 and above.
Salam dan PK B40 ini akan saling melengkapi antara satu sama lain. Kedua-dua skim ini berkongsi prinsip sosial yang sama, iaitu memperluaskan akses kepada perkhidmatan kesihatan yang diperlukan, mengurangkan beban kos sara hidup dan meningkatkan kesejahteraan rakyat.
It is estimated that 73% of total deaths in Malaysia are due to NCDs such as diabetes, half of which are caused by cardiovascular diseases, and with cancer as the third cause of death in public hospitals. The urgency for higher awareness and more effective prevention of NCDs is further reflected in the financial toll, such as on the public healthcare services, which amounts to billions of ringgit annually.